So, I want to welcome everybody back to our Dairy Goat webinar series. My name is Jennifer Bentley, and I work with ISU Extension and Outreach as a dairy field specialist housed in Northeast Iowa. And this is our webinar series that we've been hosting for a number of years, and we're coming back this fall. We took the summer off, and so we hope everybody had a wonderful summer and look forward to the topics that we have coming up this fall on our series, and then into the next year, into 2026. We'll start announcing those towards the end of the year here. So this is part of a overall project that multiple states are working on, the Sustainable Dairy Go Agri-Systems Project. And so if you'd want to learn more about this project, you could go to, we now have a website, www.dairygoagrisystems.org, and you'll be able to learn more about the project, as there's many working components that we're working on. It's a 5-year grant through the USDA. And so there's a lot of components that we'll be sharing out here in the next couple of years in regards to dairy goat health, dairy goat finances, the community aspect, just a lot of different components that we're all involved with here. So I'm happy to have on with us today one of our project collaborators, Dr. Liz Eckelkamp. She's a dairy extension specialist and associate professor of University of Tennessee Institute of Agriculture. And today she's going to be providing us some great information on understanding udder health and managing mastitis. So thanks for joining us here today, Liz. And if you wouldn't mind just advancing the slide one more there. We'll just give some key webinar guidelines in case anybody forgot through the summer, just some things with Zoom, but just reminder to all to make sure you're muted unless you're speaking, just to help reduce background noise and distractions during the webinar. If you have questions during the presentation, feel free to use the chat box and we'll answer those either as they come in if they're relevant to what Liz is talking about, or we can hold those to the end as well and do a Q&A there at the end here. And if you have any tech support or anything you need to message me, you can certainly do that. So, and this session is recorded and it's going to be shared out to you via email as well as it's going to be on our YouTube channel within the week. So you'll be able to go back and view that and share it out with other people. One other thing I did want to note, and I'll also put this in the chat, is through this Sustainable Dairy Go Agri-Systems grants, we also are starting a newsletter, so that'll help you learn more about the project. I have the link on the bottom left there, but I will put that in as an active link into chat. So if you want to just follow along, we're going to be providing some quarterly newsletters with that and help you stay connected that way. So with that, I'll do a little intro to Liz and more about who she is before we get started here. So like I said, she's a dairy extension specialist for Tennessee, and her research and extension projects focus on animal care, milk quality, housing, novel forages, farmer perspectives, precision dairy technologies, and economic opportunities across the dairy industry. She provides on-farm support and continuing education training for all stakeholders across the dairy industry. She's involved as a director for the Center for Dairy Advancement and Sustainability at UT and for the regional program, Southeast Dairy Business Innovation Initiative. And she also is a part of the American Dairy Association, the North American Intercollegiate Dairy Challenge Board, advises the Dairy Club, Dairy Judging Team, and Dairy Challenge Team at UT. So I'm glad you could squeeze us in, Liz. It sounds like you're very busy there in Tennessee, but with that, I'll let you take it away.
Yeah, I think the take home there was that I'm kind of a one-stop dairy shop and I have problems saying no, I think was the takeaway from that intro. Hey everyone, I'm looking forward to talking to you today about udder health and managing mastitis. Depending on y'all's background, this might be a lot of things that you already know, and we're just kind of refreshing some of those topics, or it might be new to you for the first time. And if y'all have any questions, like they said, feel free to put those in the chat. If they are timely, I do not at all mind getting interrupted and answering those questions live. So whatever y'all want to do as we go through here is fine with me. We do have a little pre and post knowledge test for you guys. I know that's exactly what you want to do on your lunch break, was take a quiz. So thank you for playing our little game. Thank you for going through that with us. So today, we're going to talk about the udder. We are going to spend a ton of time talking about the mammary gland across more of our small ruminant species. So I know the title was goats. You will also see me talk about some of the stuff that we do and don't know about sheep as well, and kind of compare them back to our large ruminant or our cow dairy. So first big thing that you have to think about, right, is that instead of our 4/4 that we're used to, we are now talking in halves. Please have grace with this cow person as I accidentally call them quarters at least once during this talk. And some of the other things that we'll see that are a little bit different with our sheep and goat dairy producers is it's much more common to see, I don't know if y'all can see my cursor, to see at least some amount of nursing of mom in these small ruminant species compared to our traditional cattle dairies. So diving on in, what we're going to talk about today is a little bit about the mammary gland and its structures, because if we don't necessarily understand the physiology behind it and a little bit of the science behind it, it becomes much more difficult to apply some of those management practices and decide why they're important and which ones I'm going to pay lip service to and which ones I'm actually going to follow pretty religiously. We're also going to talk through the different types of mastitis that are common in our small ruminant populations compared to our dairy cow populations, and then what we can do to try to prevent this from happening in the first place. And yes, there are lots of lovely pictures of different sheep and goats experiencing mastitis and udder trauma throughout this presentation. That is your preemptive trigger warning as we go. And like I said before, if y'all have any questions, feel free to throw them in the chat, and I will try to answer them as we go, or we'll definitely come back to them at the end. Diving into our mammary gland, when we start thinking about that mammary system or that udder, we are still going to be focused a little bit more down here with the ewe, the goat, and the mare with this inguinal line. And our overall is going to be 2 halves instead of our 4/4. So right here we can see with our ewes from our sheep and our goats from, our goats. But I want to really focus in on how that physiology is still similar to cattle, but different at the same time. So our big thing here is that we're going to have 1 overall canal and 1 cistern per teat. So we don't have 2 like a camel, which is fun, and we don't have this multi-duct system like we would see in mares and sows. So overall, our physiology internally, very similar between our cows, our sheep, and our goats, which is why you'll see a lot of literature doing comparisons between the two, even though we acknowledge that they are different and what we can use to treat some of those things. The overall structures that are really key to know are going to be our lateral suspensory ligament. It's this thing that's labeled number 1 over here. That lateral ligament is what holds the udder in to itself. So that's part of what helps it keep its side structure and its side shape. The one we think about most often externally tends to be this median suspensory ligament, or this MSL. This MSL is what is going to hold that udder up against the body wall of the animal. So if we're looking at the back end of a cow, and we're talking about having a tight MSL that's really sharp, we're talking about that very defined crease that we can see running up the back of that cow's udder. And that's also what we'll see in a sheep or a goat. What's really important about this median suspensory ligament is, like with all ligaments, right? They do not get tighter with age. They do not get tighter with use. So thinking about from a perspective of breeding purposes, or for animals that we want to keep in our flock or our herd for multiple lactations, watching how that median suspensory ligament behaves, watching how that lateral suspensory ligament behave, are going to be very important for trying to minimize future chances of mastitis and making sure that we can maximize production from those animals. Our next piece is going to be those teat ends. So we'll talk about this a little bit more in a second, but there is one way out and one way in from an udder, right? So that one way out and that one way in is going to be housed in that teat end. And then that last piece we need to think about from just a general description of the udder is going to be that rear udder attachment. So when we're talking about capacity, when we're talking about the ability to go through multiple lactations, we want a high rear udder attachment, whether it is a rear udder attachment in a cow or a sheep or a goat. We want a strong median suspensory ligament, and we want similarly shaped teats that are of moderate size and moderate length. And trying to breed for all of those and manage for all of those helps us make sure that we can consistently attach a milking unit, make sure that we can consistently breed this animal back and maximize milk production while limiting any external trauma to that udder, external trauma to those teats, and reducing our risk of mastitis. Some other structures we need to keep in mind are that teat sphincter itself. So this teat sphincter is exactly what it sounds like, right? That is what is the guardian of that mammary gland itself. So that teat sphincter is what we think about trying to protect when we do a post-dip. That teat sphincter is what we'll think about trying to allow time to really completely close and wall off each of those halves after milking. So those recommendations that come out about saying make sure they stand 30 minutes after milking, and they're not going out into a dirty area. That's what we're trying to protect is that teat sphincter. Same thing if we're trying to manage for reduced teat calluses, we're trying to protect that teat sphincter and reduce the ability of bacteria to get up and into that udder. Next thing we're going to have is our teat cistern. So this and the gland cistern are where milk will sit before a milking actually happens. So those will fill up with some amount of milk, and we want them to be able to have a little bit of milk left in them after a milking as well. And if we're looking at a sheep or a goat, we would expect maybe an eighth of a cup to a quarter of a cup of milk being available from that teat cistern, that gland cistern at any given time. And that becomes really important when we start thinking about the secretory tissue itself. So up here in the rest of the body of the udder, all of this is going to be secretory tissue that is teensy tiny microscopic. So if you look at this alveoli, this alveoli is actually the milk secretory unit of the cell. And each of these is going to be about the size of a tip of a push pin. So super, super, super tiny. And that alveoli is responsible for making milk in these lumen epithelial cells and expressing milk with those myoepithelial cells. So if any of you have ever heard about the timing it takes from first touch to first attachment, what we are really focusing on is making sure that oxytocin, which is extremely important for milk letdown, it is the milk letdown hormone, right? That first touch on the teat end, on this right here, is going to send neurons firing back to the brain that says, hey, someone is trying to milk me. And that is also that same mechanism that's going to be fired if we think about a kid or a lamb headbutting that bag as well. That is part of that neuron system going, hey, we want milk. It's time to release oxytocin. It takes about 60 seconds from that nerve ending firing, getting back to the brain, for oxytocin to actually get back to the udder and start working on these myoepithelial cells. So these myoepithelial cells are basically muscle cells, like super teeny tiny microscopic muscles, and they will contract. As they contract, milk gets expressed from all these epithelial cells. Think of like a portion of a drop of milk. It's going to get expressed from these epithelial cells. They will travel down these ducts. The ducts then travel into the gland cisterns, all down through here, and then finally down into the teat cistern. So think about it kind of like the same way that we would expect water to travel from a little bitty mountain spring all the way down to the ocean, right? So our alveoli is our little bitty mountain spring where it's popping up out of the ground. It's traveling through our duct system, traveling into our cistern. So it's traveling into a larger water body. It's traveling into a river, it's traveling into a lake. Finally, we're going down into the delta and out into the ocean would be when we're coming out of that teat sphincter. So to maximize all of those things, protecting every step along this process, super important, but also understanding why there is such a thing as milking too quickly, there is such a thing as milking too slowly, and what damage to each of these secretory sections does when we have a case of mastitis. But kind of like we talked about before, it is a closed system, right? The only way in to that udder, ideally, the right way, is going to be crossing the blood barrier, and that's going to be nutrients required for making milk synthesis in the first place, or somatic cells that are entering that mammary gland. As a quick reminder, our somatic cell count is, or our somatic cell is just our fancy dairy word for white blood cells. Why we decided to call them somatic cells at some point in our science history? It's because someone isolated them and said, oh, look, body cells, but they are really just white blood cells. They are the exact same thing, just once they enter the mammary gland. The other way to get in is entering through the teat end, and that's how we would be worried about pathogens actually entering. Once those pathogens enter, sometimes they stay for a little bit and the body's immune system kicks them out. Sometimes they kind of wall themselves off and stay forever, and some do not respond to treatment. And we'll talk more about that here in a second. With mastitis, that is inflammation of the mammary gland. And we tend to think about that being caused by bacteria. That's usually the big bad guy that we think about when we think about terms of mastitis. So we think about reaching for a tube of antibiotic, or we think about trying to maintain a really clean environment. We'll go through more of that later. But there are other things that can cause mastitis issues as well. One of those is yeast. So if we look at yeast under a microscope, that is what this guy looks like. It grows by budding. Yeast is not a bacteria, so it will not respond to an antibiotic. We can have persistent yeast infections that cause mastitis in all mammalian species. And one big trigger for having yeast infections in that udder to cause mastitis is going to be improper cleaning of that teat end. So basically, we introduce something there. Usually it's if we're trying to dry treat that animal, or if we're trying to provide a tube of antibiotic for another infection. If we don't fully clean off that teat end, or if we don't have good management of that antibiotic tube, we can unintentionally introduce yeast into that mammary system, and then it just kind of hangs out and stays forever. Another one that we don't always think about that is can be a pretty significant contributor to mastitis is algae. And you'll see a lovely little note from me further on in here where there are sheep in a pond, and I say absolutely not. And this guy is one of the big reasons why absolutely not. Algae can colonize the mammary tissue and continue to cause mastitis infection. So this is one reason why it's really important to maintain a clean and dry environment, try to keep them out of big water bodies where one of the first things that gets submerged is going to be that udder, because algae, again, not a bacteria, will not respond to an antibiotic treatment in that udder. So once it's there, it's kind of going to stick around for a while. Or trauma. Trauma can also cause inflammation of the mammary gland. So whether that is trauma caused by offspring nursing, trauma caused by getting caught in something, trauma caused by stepping on teats if we've got a really poor median suspensory ligament or really long teats, all of those can cause inflammation of the mammary gland. And if we damage that teat end, we've made it that much easier for any of these pathogens to get in and continue to cause an infection of some kind beyond simple inflammation. So I talked about this a lot kind of in theory, but here is a pretty good diagram of what happens when we have a case of mastitis, right? So here is our teat sphincter, our teat cistern, our gland cistern, and all of our alveoli that are up here that are going to be producing milk. Remember that they are much, much smaller than this. But if we have bacteria that come in and make it past that teat sphincter and into the teat cistern, yes, we will have a body response. Those are going to be these neutrophils. Or it's going to be things like macrophages coming in and trying to destroy all of these invading bacteria, and that's the body's normal immune response. This is why we see that increase in somatic cell count in response to an invading pathogen. But what can happen is they damage enough of those epithelial cells in that alveoli in the first place that that whole alveoli actually dies. So we are losing secretory tissue within the mammary gland. Sometimes that will recover with udder involution, and sometimes it does not. So if any of y'all have ever felt like the hard nodules on the inside of an udder, that is a section where we have atrophied alveoli inside that mammary tissue itself. We can also have some of these bacteria that will actually invade secretory cells and just kind of hang out. And Staph aureus is one of our most pernicious mastitis bacteria causing species that exist. Staph aureus are extremely resistant to the body's attempts to get rid of it. They're also extremely resistant to antibiotic ways to try to remove that from the udder itself. It can essentially wall itself off in the udder and then reappear when things become more favorable for them to continue proliferating. So in dairy cattle, we think about it a lot as we see kind of these waves of spikes of low somatic cell, high somatic cell, low somatic cell, high somatic cell. I realized my finger was going the wrong way as I said that. But you could see something similar in our small ruminants with that Staph aureus infection. We don't usually get the udder rot effects of Staph aureus in dairy cattle the way that we see them in small ruminants, but we will see that they are kind of persistently infected with that Staph aureus in particular. Like I said before, somatic cell count, fancy word for our white blood cells that are circulating in the mammary gland. And they really only increase in response to infection, sort of, kind of. Sheep and goats are weird. In dairy cattle, they only increase in response to infection. In sheep and goats, we'll see that there is a lot of variation that occurs naturally throughout a lactation, so the further away we get from lambing or kidding, and also across lactations, the more lambs and kids that we have. And their primary purpose is to destroy invading bacteria or to attempt to destroy invading pathogens. Like I said, if it's an algae, I'm like, I don't know what to do with you. Or if it's a yeast, I don't know what to do with you. But bacteria, they're generally pretty good at. And almost always in the literature, we can agree that anything over 1 million cells per milliliter, so 1 million somatic cells per milliliter of milk that we are testing, is generally associated with an infection. But now when we get into sheep and goats, there is a lot that we do not know. And there's a lot that we're still trying to better understand, and that some of my graduate students are working on here. There is a lot of disagreement about what somatic cell count is actually linked to infection. On the cow side, we're pretty confident. We know that anything over this particular threshold is going to at least indicate a subclinical infection. There is a reason that that somatic cell count increased. We just don't see that in the same way on sheep and goats that we do in dairy cattle. There's also a lot of disagreement on what our common pathogens are. There's also not a lot of studies out there on what our common pathogens are, especially not within the United States. There's also disagreement on treatment because there are no labeled intramammary antibiotics for sheep or goats. Can you get things to treat mastitis cases? Absolutely, but they're all off-label. So having a good relationship with your veterinarian, having a very robust veterinary client-patient relationship is very important to trying to proactively treat some of these cases of mastitis. When we think about our types of mastitis, we have two overall groupings. One is clinical, and that's where we would see visual or clinical signs. So if you look at this top picture, that udder is red, it is inflamed, it looks angry, right? We would also expect to see some flakes or clots in the milk itself, potentially changes in the appearance of milk, so the milk might appear watery, in addition to being able to palpably feel heat on the udder and see redness and swelling in the udder itself. With subclinical mastitis, this is much more common across every dairy species. I don't care if you're a cow, a sheep, or a goat, or a water buffalo, right? It is much more common to have subclinical mastitis than clinical. And that's because there are no visual signs with subclinical mastitis. All we have to go on for this is an increase in somatic cell count because they are coming to the udder for a reason, and being able to isolate bacteria from that udder. So a causative pathogen, right? Bacteria is probably the wrong word. A causative pathogen from that udder that is causing that increase in somatic cell count. You can see in our lower picture, overtly, that udder looks fine, right? But we might have some issues inside. If we think outside of our dairy world, some common terms that you may have heard would be blue bag, and that's a lack of oxygen that's actually reaching the udder, and that's what's going to give it kind of a bluish tint by being unoxygenated, or hard bag. And hard bag is going to be physically hard nodules that we can palpate or feel inside the udder from either a current or a previous mastitis case. And we would typically think about things like Staph aureus as being causative agents of things like hard bag. Beyond having clinical and subclinical, we also have two overall groups that cause mastitis. We have our contagious mastitis pathogens, and those are spread from animal to animal. And then our environmental pathogens, which are spread from endemic to the environment. We also sort of have opportunistic, but most of those have been reclassified as contagious, and we can talk more about that here in a second. Within contagious mastitis in small ruminants, our two main culprits tend to be Staphylococcus aureus, which a lot of y'all put on the pretest, and then Pasteurella hemolytica. That tends to be our other main culprit for contagious mastitis. Staph aureus tends to be spread at milking time, and that can be spread from dam to offspring during nursing, And it does account for a decent chunk of mastitis, so 3 to 37% in small ruminants. But the other one that we'll see a lot is Pastorella hemolytica and those Pastorella species. And those are spread from nursing lambs to the dam. And that is really the only way that we see Pastorella mastitis become an issue. And what we'll see with Pastorella is that that lamb or that kid will have some kind of upper respiratory infection. That upper respiratory infection, coupled with nursing from mom, is when we'll get that Pastorella infection in the dam. Staph aureus, we'll tend to see that more. Staph aureus grows really well on our hands. So if we are milking without gloves, we can actually be the vector of introducing that contagious pathogen to that sheep or that goat. It also will survive quite happily on milking equipment going between one animal that is infected and another one that is not infected. We also see Staph aureus infections get linked very closely to flies. So biting flies on the teat ends can spread Staph aureus from animal to animal to animal. But again, also some from the nursing dam, from the nursing offspring to the dam. So the ones that we'll see are going to be Staph aureus, Strep agalactia is going to be another one, Mannheimia hemolytica, which is also Pastorella hemolytica. It's another word for that. We also have another Pastorella, some Truparella pyogenes, Corynebacterium, and Streptococcus zooepidemicus in goats specifically. So these tend to be the big ones that we'll think about as far as contagious mastitis pathogens in sheep and goats. The next one is one that we tend to think about a little bit more because our animals are always in the environment, right? And those are going to be our environmental mastitis. And you probably think most of these around E. coli for our gram-negative species. But that can be E. coli, it could be Klebsiella, it can be Serratia. There are a whole host of bacteria that fit into that gram-negative species box. And we manage most of them the same way. And then we have our big environmental streps, so our Strep uberis and our Streptococcus galactia. These tend to be the big guys that we worry about from an environmental side. And there is no way to completely remove them all from your environment. I had a dairy farmer ask me one time, well, how do I keep cows from having EHECO 157? I was like, you don't. They just will shed it if they have it. There is no way to kind of put everybody in a bubble and fully protect them. So our best bet, right, is trying to make sure that our milking procedures, our management practices, and our animals are as equipped as they can be to resist some of these bacterial incursions. So like I said, we've got our E. coli's, our Klebsiellas, Enterobacter is another one, Serratia, Pseudomonas, Proteus, and then our streps, and even Bacillus. Bacillus can and does cause environmental mastitis issues. Usually when there is some kind of additional teat damage, though, is when we'll see Bacillus infections. For our opportunistic guys, we talked about these a little bit earlier. We have our yeasts, and those are generally acquired during a mastitis treatment or a dry treatment because we haven't gone through and fully cleaned off that teat end with alcohol swabs, or we have put that plunger to administer that antibiotic too far into the teat canal. The other one is our coagulase negative staphylococci, and our new word for these is non-orus staph, because there are some staph that will still coagulate and not be Staph aureus, and they tend to respond, or not tend to respond, they tend to behave very similarly to contagious mastitis pathogens like other staph species. We've seen that more and more over the last several years, which is why that name change. But these guys are actually responsible for the majority of mastitis infections, are non-orus staph species. So those could be things like Staph hyacus, Staph chromogenes, and again, trying to make sure that we're protecting her from her world, and then doing a really good job with our parlor practices and identifying sick animals. It's going to be our best way to try to maintain some of these. Like you can see a whole host of different staphylococci bacteria in that opportunistic mastitis list. If we think about the impacts of mastitis, I will hear this a lot from dairy goat producers in our region that their goats just don't have mastitis. And we would argue more from the dairy side, from the dairy cow side, right? That if you don't have it, you're probably not looking for it. But some external things that we'll see for mastitis are things like decreased milk production. So they will not be matching the yield of other mates in the flock or in the herd. Decreased product quality is going to be a really big one if we're thinking about this from a value added perspective and we're thinking about chev yields, if we're thinking about actually getting a hard cheese of some kind where getting a good curd formation is really, really important. That will actually decrease if we have mastitis at a higher rate, increased somatic cell count. Curds do not form very well. We also have a decreased shelf life because along with mastitis, that increase in somatic cell count usually comes an increase in bacteria. So that increased bacteria, we do not have as long of a shelf life on whatever product we are making, if we're making something on our own operation, or even if we're selling our milk to a cooperative. If we think about this from more of like our meat and show animal and our young stock perspective, we see a decreased average daily gain on any of those young animals that are nursing a dam with mastitis because her milk production is going to go down. Her milk production, her milk components are going to be impacted, so her fat and her protein. And those lambs and kids are not going to gain as quickly on a dam with mastitis. And we can potentially have lamb or kid loss if their nutrition falls too low, or if we get some kind of secondary infection into that offspring from nursing a dam with mastitis. All of these numbers are going to be coming from Italian farms because, like I said, there's a real lack of data in the US about what our common pathogens are and how we respond to them. That is part of what we're trying to do within our lab group down here is get a better handle on what types of causative mastitis pathogens we have in the state of Tennessee and hopefully try to expand that a little bit beyond just us here. But this was a long-term study back 2013 to 2017, had around 21,300 milk samples across almost 1,000 farms. And you can see the pathogen types stayed fairly consistent throughout the years, with those coagulase negative staphylococci or those non-orus staph being the primary causative agents, followed very closely by staph A, and then a group of different environmentals. So the Pseudomonas, the Strep, the Enterobacter, the gram-negative, the Streps, and the Carnioforms. All of these we would lump together in those environmental mastitis baskets. But far and away, we've got those staphylococci species causing trouble. We see the same thing again in sheep mastitis on almost 4,400 Italian farms, almost across almost 69,000 different sheep milk samples. We still see those coagulase negative staphylococci, those non-orus staph. We still see Staph aureus as an issue, Strep uberis, a little bit more Pseudomonas, a little bit more of those gram negatives. But again, staphs are still the biggest issue that we're seeing in both sheep and goats. I said a little bit earlier that in dairy cattle, we have a pretty robust understanding of what somatic cell count increase, at what point that means that we're going to have a subclinical mastitis infection. And we all pretty much universally agree that anything over 1 million is going to be a mastitis infection, whether that's subclinical or clinical. And in sheep, we seem to have a little bit more consensus in the literature that follows pretty closely to cattle. So cattle, we'd be thinking about this 4 break being where we would be concerned. So anything over 200,000 cells per mil, again, that's 200,000 of those somatic cells, those white blood cells per milliliter of milk. Anything over a 4 on this linear score, anything over a 200,000 is where we're going to at least want to look and see if we can get any bacterial growth from that udder. And anything under that is generally considered healthy and not an issue. So normal circulating somatic cell count levels. In goats, we have this whole fun little suspect guy where maybe at a lower somatic cell count level, we're still concerned about having bacterial populations in that udder causing mastitis, and a little bit higher where we're not really concerned about there being bacterial populations in that udder causing mastitis. But even over that 1 million, we're still kind of all agreeing that yes, anything over here is going to be a concern. And part of why we have that disagreement and why we'll also have in our pasteurized milk ordinance, there is a different threshold for goats than there is for sheep. And we'll see that based on the circulating somatic cell count that is generally higher in sheep and goats than cattle. And we'll also see that, like I said before, as lactation progresses, so as we get further past lambing and kidding, that somatic cell count also increases naturally. So it's very difficult to diagnose subclinical or clinical mastitis based only on somatic cell count in small ruminant species. And you'll see here both for goats and for sheep. So this LS, that's going to take you back to that linear score on this previous sheet, right? So linear score 4 in cattle, we would generally consider anything over that suspect for mastitis. We see that for sheep. And then that linear score of 6, where we're starting to say, yeah, it's probably mastitis in goats as well. So that's what all those LSs are. So for sheep, we'll see that they start off down here, fairly low, around a 3. But even if we are just a third or a fifth lactation animal, we are naturally higher in somatic cell count, kind of right off the bat. And that as that lactation progresses, eventually we will cross over this threshold in just our average somatic cell count that's circulating within sheep. Within goats, we see that we get above that threshold very rapidly in 3+ lactation animals, so animals that have at least been milking, had 3 distinct different lambing, or I guess that would be kidding seasons. We're going to see a big increase in somatic cell count fairly frequently. Now, you might see this less if you have a shorter milk window on your particular flock and you're not going all the way out to 275 days, you might not see as many of these impacts. But if you're milking for, I'm going to do math really quickly. If you're milking for over 200 days, we are going to start to see, I guess even 150 in goats, we're going to start to see some of these natural increases in somatic cell count that may start having negative impacts on your processing if that is something that you're doing, or negative impacts on your milk check, depending on how you're selling and marketing the product from your farm. If we go back and look at to see what the literature has to say, there is a lot of diversity in which level is going to be concerning. It goes all the way down to 250,000, all the way up to 500,000 cells per mil. And that choice really depends on the goal. And it really depended on how serious that goal was, how serious was the consequence. So if we were going to cull animals based on somatic cell count, or if we were going to decide if we're going to dry treat animals based on somatic cell count, we tended to see those be a lot higher. So we would tend to see that recommendation for an issue would be closer to 500,000 cells for like culling or dry treating. If we're trying to identify subclinical mastitis, depending on our next follow-up steps, we might have a stricter threshold, right? So something around that 250,000. One way you can look at these somatic cells is with the California Mastitis test. I don't know if y'all can do a quick show of hands with your little hands up display of how many people have used a California Mastitis test or know what I'm talking about with that one. I'll use your little hand thing. I think I can see it. Thumbs up, few people, 1 or 2. Yeah, 1 or 2 or 3. So with that California Mastitis test, really what we're focusing on here is a gelling reaction. So we put equal amounts milk and the reagent for this rapid side cow test in each of these little wells. We only need to, you can either do 2 goats or 2 sheep at a time, just use 2 of the wells, or you can test your repeatability and just do the same half twice. Add the same amount of that reagent and swish it around. And what we're looking for here is how much gelling reaction we see. So negative would be no gelling seen at all. Trace is going to be a small amount of gel noticed if you're kind of tipping the paddle. 1+ is going to be a significant amount of gel seen when we're tipping that paddle. 2+, if the paddle is swirled, the gel will actually kind of clump in the middle. And 3+ would be that mixture is completely gelled and it clumps in the middle when swirled. But the trick is we'll start to see this trace and the significant amount of gel seen when tipped at those levels of like 300 and 400,000, which still might not indicate an infection in your sheep or in your goats. So another thing that we can do is on-farm culturing. And I don't know how many of y'all are familiar with this system or if you've heard about it before. I put the link in here to the lab itself. This is the Minnesota Easy Culture System. And the idea here is that from University of Minnesota, you purchase these plates, and each of these plates will grow specific types of bacteria. So on your factor and your McConkey will grow your gram negatives, your factor will grow your gram positives. So if it grows on this side, we know that we either might need to treat it, or at least we know what our potential pathogens might be and kind of narrow it down a little bit. On this other one, we've got a McConkey, a factor, and a focus. Your McConkey, again, grows your gram negatives. Your factor will grow your gram positives, so your steps and your streps. And your focus, I believe, only grows your streps. Don't quote me on that. I'll have to go back and double check. But it is all in this handy dandy little manual that comes when you order the kit. And the other piece that you need is literally an egg incubator that you can pick up off of Amazon or from Tractor Supply or Rural King or wherever you get your farm supplies from. It is very accessible. You can order everything you need from them. And they also have a little diagnostic guide that shows you how to try to troubleshoot and figure out which pathogens are causing an issue on your farm. And they usually grow, well, you'll have growth within at least 48 hours of plating it that first time. So can be a good way to figure out what's going on your operation, especially if you're not close to a university lab or a veterinarian that can do a lot of this for you. Some other services that you can use to get a better idea and handle on what is your somatic cell count, what does your milk quality look like, is a DHIA laboratory. There is a DHA equivalent for sheep and for goats. There are also herd management systems specific for sheep and goat producers. Within PC Dart for sure, there's probably some other ones, but that's the one that I'm most familiar with down here. Dairy Farmers of America also has laboratories, or DFA has labs in a couple different cities. We have one here in Knoxville that can do general milk characteristics and bacteriological culture. So it can tell you things like what is your somatic cell count, your fat, and your protein, along with what types of causative pathogens are causing a mastitis infection if you have one. Some local veterinarians will perform this service as well. And like I just mentioned, there's also that Minnesota Easy Culture system that you can use on farm. Beyond those, kind of saw that we have some people from Spain, from Mexico. We've got some from Iowa, Tennessee. I'm sure we have people from a few different other areas as well. But there are also dairy business innovation initiatives across the U.S. That's this little that little SDBI on the side of me. That stands for Southeast Dairy Business Innovation Initiative. And we have a lab here on campus where we can do milk components, not so much bacteriological culture, but where we can do milk components and help dial in somatic cell count, fat, protein, and similar resources are available in the Northeast at Northeast DBIC, in the Midwest at the Dairy Business Innovation Alliance based out of Center for Dairy Research at Wisconsin, and then over on the Pacific Coast at the Pacific Coast Coalition DBI based out of California. So some other resources that you might not have been as aware of before today. But big things to keep in mind for all forms of mastitis is an ounce of prevention is worth a pound of cure every single time. And most of our preventions are relatively simple, relatively inexpensive, and just take a little bit of time to implement. As far as our keys to contagious, we really would think about being spread from lamb or kid to dam for a lot of those, for Pasteurella in particular, and then being spread from dam to dam for things like Staph aureus. And the best, really only way to find it is to culture. Quite often these will still show clinical signs, but it might be a little bit further down the line, or we might be having an animal that is persistently infected. So it comes up and then it goes away, and it comes up and it goes away. But once we know they have it, our best option is to isolate infected dams or offspring. And then also check back for some of those telltale signs at lambing or kidding. Some of these are going to be normal, like we would expect to see some edema after lambing or kidding. But if we feel that hard bag with a bunch of nodules, if we see a red or swollen udder, or other clinical signs, like I mentioned, those flakes or clots or changes in literally the appearance of the milk itself, those are great indicators to go ahead and culture and figure out what we have. Um, like I said earlier, with Staph aureus and even a little bit with Pasteurella, mostly with Staph aureus, culling is really the only solution. Staph aureus does not respond well to antibacterial treatment in cattle or in sheep and goats. And in sheep and goats, more so than dairy cattle, the entire udder can slough off, and udder amputation is generally recommended if this starts to happen. So instead of letting this move through your flock very quickly, if you identify any animal that has Staph aureus, culling is really your best option in trying to remove that contagion point from your herd. As far as our keys to environmental, can't necessarily put them in a plastic bubble and leave them there, but we do need to think about how do we minimize some of those risks within our environment. So I always point back to our CDCs, not the Center for Disease Control, but our clean, dry, and comfortable focus in our housing and in any area where we're going to put dairy animals. We want them to be clean, dry, and comfortable. And part of that is that clean and dry area is going to reduce bacterial loads at the teat end. So the environment that they're just in is going to be a little bit cleaner, a little bit less bacteria ridden, and it also reduces the chance of material attaching to the teat end itself. So if we think about that teat end being a potential area where we're going to have all of that bacteria trying to get into the udder, if we have bedding that's actually stuck on that teat end all of the time, it dramatically increases our risk that those bacteria are going to be able to get through that teat sphincter and then invade that udder. It also reduces additional stress on the dam. We have a lot of literature on the cow side that shows that cows prefer to lie down in dry areas and in dry, comfortable areas. So if we have a lack of bedding or if we have wet bedding, it decreases lying time. Decreasing lying time is very much associated with increased stress. When animals are under higher stress, their immune system gets challenged and it is much more likely to have an issue pop up like mastitis because all of our cylinders are not firing at 100% capacity. So if we do that, we can also reduce disease likelihood in lamb and kids for a lot of the same reasons. We're not as worried about the material attached to the teat end in the lamb and kid situation, but still making sure that they're not getting those upper respiratory infections that could then get transferred to mom via the udder and nursing. If we're on pasture, we want to avoid wet and muddy areas. Again, because we want to make sure those animals are clean, dry, and comfortable. We don't have excess material that is adhering to those teat ends. But then absolutely no ponds. I really do not enjoy seeing livestock species of any kind going into a pond and drinking or wallowing or anything like that. And one reason is we want to make sure we're maximizing milk production, right? A big way that we do that is providing clean, freely abundant drinking water that isn't going to limit intake in that way. The other reason is because as soon as their feet go in, the thing that quickly follows after that is going to be their udder. And we really want to protect that moneymaker. If we have submerged that udder into a pond, bacteria can swim really well. And we have just kind of provided a super highway for them to go to that teat end and try to get into that udder. So things like Pseudomonas really like the wet, Proteus really likes the wet, yeasts and molds all very much like the wet, but Prototheca is that algae that will get in the udder and colonize it and stay there forever. So really from a production and management standpoint, yes, I realize it can be expensive and it can be a pain to run water out to animals in a pasture, but in the long run, it is very, very much worth it to protect that udder, protect your milk production capacity, and just prevent some of these things from ever happening in the first place. In the barn, we want to make sure we maintain lots and lots of clean bedding. And routine bedding maintenance is going to be key to those CDCs. So whether we're using straw, shaving, sand, whatever kind of bedding you're using in the barn, I am very much aware that dairy producers can make almost any situation work aside from the pond. But whatever type of bedding you're using, making sure that it is routinely managed and routinely changed so those animals remain clean, dry, and comfortable. We don't have a heavy ammonia load in the air. All those are going to be very important for keeping your young stock healthy, keeping your older animals healthy, and reducing mastitis cases. In the barn, we want to pay extra special attention to things like our drop pins, our mixing pins, or our lambing jugs. Think about that as kind of the equivalent of being worried about the calving pen and the fresh cow pen, right? We want to make sure that these animals that are already going to be in a heightened stress and immunocompromised state have the best potential care out of anybody in the flock or anybody in the herd. And again, preventing that respiratory disease in offspring like pneumonia helps prevent Pasteurella hemolytica coming over and getting mom. In the parlor, gloves are so important. I don't care what type of milking system you are using, gloves are incredibly important because these grow bacteria really, really well, and they are very good at transferring bacteria from animal to animal to animal to animal. We also want to limit water use. I will hear from different producers that they're using a decent chunk of water in the parlor to try to get off any material on the outside of the teat ends. I would want to take a step further back from that and try to prevent us getting to a point where we have a lot of material adhering to the teat end anyway. But if you do have to use water in the parlor, we want to make sure that whatever we put on, we take off because that water is going to run to the lowest point on the udder, which is going to be that teat end opening, which is our weakest point on the udder. Because if we just dip around it, that water droplet full of bacteria is still there, right? So whatever water we put on, we need to take back off and use effective pre and post dips. This could be iodine based, chlorhexidine based, hydrogen peroxide based is out there and an option. I don't tend to recommend it for our dairy farms. Down here, any of our dairy farms where we're worried about a lot of organic matter being stuck on the outside of the teat end, hydrogen peroxide does this really cool thing where it foams up and looks really impressive, but it is very quickly inactivated by organic matter that it comes into contact with, which is why it does that really cool foaming trick. So if we still have shavings, sand, mud, anything on the outside of that teat end, the hydrogen peroxide is going to react to that. And then its killing potential to go try and go after the bacteria that we actually want to get rid of is very much gone. And it's extremely important that we leave that pre-dip on for at least 30 seconds. Kind of put your brain back in kindergarten mode. However long we need to wash our hands, 30 seconds, right? That soap actually has to stay touching our hands to kill bacteria before we wash it off. The exact same thing with our pre-dip. I don't care how fancy your pre-dip is, it cannot kill in 2 seconds. So leaving it on there for at least 30 seconds. One, we get that oxytocin time to get back to that udder. Two, we're fully killing off all of that bacteria, or mostly fully killing off all of that bacteria to make sure that when we milk her, we're not unintentionally introducing some bacteria. And we also want to limit over milking, whether that is using a system with automatic takeoffs based off of flow rate to pull it off of the udder once she's done, or making sure that we're not milking her until she's completely dry. We want to leave a little bit in each of those halves to make sure that we are not over milking that teat end and that we're not causing any teat issues or hyperkeratosis. It's a great question on preference for iodine or chlorhexidine. They both work well. They both have good efficacies. There are some recommendations from National Mastitis Council on what iodine level to use. I will have to go double check that and get back to you on that particular question as far as percent iodine. But there's been so much research around iodine and chlorhex. They are both very robust. And any of your equipment dealers, I'm sure, have a recommendation of one for you to use. The one thing I didn't talk about a lot on here is post-dips. Depending on what area you're in and depending on what kind of challenges you have, if you're having a lot of environmental mastitis issues, an effective post-dip and utilizing something like a barrier dip, so a slightly higher iodine percentage with some additional emollients and skin softeners in it, can help protect her a little bit more once she goes back out into the world. So if your only housing system that's available, thank you, Jen, is going to be something like pasture because that is what you have. And that's okay if that's what you have, but you know you're heading into a muddier season. going ahead and switching to something like a berry or post-dip can help protect that udder a little bit better moving into that season. Or if you know you're entering a rainy season, something like that can help protect that a little bit more. On the farm overall, we want to try to provide as non-stressful an environment as possible. Because again, as we get more stressed, our immune function tends to go down. So we want to pay attention to seasonal stressors. So whether that is heat stress or cold stress, depending on the area that you're in. Down here in my neck of the woods, it is heat stress all day, every day. We have a lot of heat stress in the southeast. We also want to make sure that we are meeting their needs from a thirst and hunger perspective, that we are not causing any pain or undue stress and fear as we're moving these animals or working with these animals. So some of the things like gentle, slow movements, trying to reduce the use of movement aids as we're going from being out in the fields up into the parlor, trying to move calmly and quietly and comfortably around all of these animals can be very important from a physical health perspective of the animal by reducing that stress. Some more kind of take homes from the literature overall. We know that poor teat conformation and udder trauma tend to increase our risks of mastitis. Udder conformation in particular has a really strong link to increased mastitis risk. So if we have extra teats, those are extra teat openings, right? Extra teat sphincters, where even more bacteria can get into the udder. Oddly shaped teats, so teats that are touching each other or crossing, teats that are very large, all of those can have an impact on mastitis or poor udder attachment. So if we look at this lady's udder, right, she does not have a high and tight rear udder attachment. It's kind of no median suspensory ligament to speak of whatsoever. And an udder that may have been fine at one point now has both of our teats touching each side of our goat. So with that, right, we are going to be, that particular animal is going to be have a much higher likelihood to be exposed to bacterial pathogens because that teat end is constantly touching something, right? I'm honestly not really sure how we would effectively milk her anyway with udder conformation like that, but that is something to keep in mind. So if you see a particular family line having a lot of poor udder conformation or poor teat conformation, maybe think about phasing out that family line or trying to bring in some bucks or rams that can help fix some of those issues through genetics. We also see that the number of nursing on that particular dam is going to increase mastitis. So if we have twins or triplets, more likely to have mastitis in that lactation. And that also goes back to thinking about those upper respiratory infections, right? So the more we have nursing, the greater likelihood that we're going to have some kind of pathogen exposure to that udder. And the age of the animal also increases our risk of mastitis. And we saw that a little bit with those increases in somatic cell count related to age, but also just overall, older animals tend to get more mastitis. Another thing we want to think about is stage of lactation. Very early in lactation, we tend to have a greater likelihood of getting mastitis. So right after lambing, right after kidding, when we're already immunocompromised. Hand milking also increases mastitis. At the time that these studies were done, I don't know if they asked about wearing gloves during hand milking, but I would suspect that that had a big impact on why we were seeing more cases of mastitis with hand milking, less so from like a teat and udder trauma way, but more just we have our little bacteria factories right here touching those teats constantly. Stocking density, as that increases, we also see an increase of mastitis. So more concentrations of animals per square foot in our barn or even in our pasture. So our sheep need at least 21 square feet per sheep if we're thinking about a big barn housing situation. And goats, we're not super sure, but that 21 square foot is probably a good starting spot to go for as well. But I wasn't able to find any good recommendations in literature for stocking density for goats. We also see that as the amount that animal produces increases, that we will also see an increase in mastitis, and that's true in cattle as well. Our high producers tend to be the ones where we see more of those mastitis issues. But then on bright spot, improved genetics can also decrease mastitis risk. So we can breed for reduced mastitis risk in sheep and goats the same way that we can in cattle. And again, breeding for some of those common sense things, good udder conformation, good teat conformation, overall animal health, those are all very beneficial to trying to decrease mastitis risk. So some things to take home and kind of keep in mind. Mastitis is a costly disease from lost milk production and lost animal efficacy. If we think about it, on the cow side, every case of mastitis costs us several $1,000s based on lost production, lost potential future revenue, veterinary bills, antibiotic treatments, the whole 9 yards. We might not have as many of those costs are compounded quite as highly in our sheep and goats, but it's still going to have lost production, lost future revenue, and then that animal efficacy and thriftiness as well. And our best defense is absolutely a good offense. And we have to monitor it before we can measure it or before we can manage it. So thinking about routine testing like DHI or going and investing in some of these things like the Minnesota Easy Culture System, and doing some things like a CMT test on your farm can all be very beneficial. And this is a picture of one of those CMT plates. So you can see no gram-negative growth, no staph growth, or sorry, no strep growth, but we do have staph growth on this plate. And this is what Staphylococcus aureus looks like when it grows on one of these plates. So you'll see that we have this really pretty little bacteria colony followed by this zone of hemolysis. So this is that Staph aureus actually destroying the red blood cells in this plate for food, which is why we get that fun little zone of hemolysis. Another thing that I wanted to point out to you, aside from the references that I used today, are some additional resources. We made these here at the University of Tennessee over the summer. I had an intern working with me. The first is a proper milking procedures video that goes through more of the timing and the steps. The second is how to take DHA milk samples. So if you don't have a tester in your region, you can invest in the milk meters yourself and do that testing on your own. And that little video clip just goes through how to do that. There are also several grant opportunities focused on dairy producers and dairy businesses throughout the US. I am fine with these PowerPoints being made available to attendees. I'm not sure how Jen's going to get them to you, but yes, they are fine to be shared. In the Northeast, like I said, we have our Northeast DBIC, and that is at this northeastdairyinnovation.com. They have a variety of grant programs. Several have gone to sheep and goat dairies in that area. Midwest, again, is based out of Wisconsin. That's that DBIA. Southeast is the one that we run down here, and we cover 12 southeastern states, so West Virginia down to Florida, over to Louisiana and Puerto Rico. And then West is going to be over in the Pacific Coast, and that's going to be dairypcc.net. And a lot of our information over here, or a lot of our focus through all these programs is grant opportunities back to dairy businesses. So there's lots of things about modernization, investing in things like the culture system, and then additional resources and technical support from all of these in addition to extension. There's also a thing, shameless plug, that we're doing here at the University of Tennessee, and we want to know about you. One of my graduate students, Riley Powers, is doing a survey of dairy goat and dairy sheep production practices across the US. Even if you're outside of the US, we'd still love to know what you're doing. There, you can use that QR code to go to the survey or click on this little URL down at the bottom. And we would love to see what y'all are doing and get a better idea of how we are managing our dairy for sheep and goats and small ruminants here in the US, and what we're doing for mastitis management, what some of your concerns are. So if we want to repost that survey at the end, we can see how everybody does, Jen. And I'll keep an eye on the meeting chat and try to answer some questions. I think there were a couple that I held off on to the end.
I think, and I also included the link to the your PDF of your presentation.
Perfect. So I think the question that I did not answer was about extended lactations. So multiple years of milking without kind of going through another lambing or kidding season. So the trick with extended lactations, especially extending out that far, is that at some point, fairly early in lactation, honestly, for both cattle and sheep and goats, is we hit a plateau of how that animal produces, like biologically. There is a ceiling, and then it will start to level off and then decrease over time. The further out we get from lambing, kidding, calving, the more that continues to decline. And the only way we really get that production potential back is going through udder involution. Just the same way that we have to go through uterine involution before we can have another successful lambing, kidding, calving. We've got to reset that system. We have to reset the udder as well. So I would recommend not going too far out past a year to maximize milk production. I realize based on your own management practices and what the goals are for your herd that might not fit what you were doing. But I would recommend still trying to not go too much beyond that 300 to 360-day window for being within a single lactation. Um, as far as management to try to reduce mastitis, it's all going to be pretty much the same, right? So try to maintain a clean, dry, and comfortable environment. Make sure we're meeting their nutritional needs. Make sure we are following those milking procedures of gloves, having an effective pre-dip, leaving it on for those 30 seconds, doing that first attachment of the milking unit within 120 seconds of first touch, using, I don't really think I talked about it there, using clean towels, whether that is a clean multi-use towel like a microfiber towel or a paper towel. We only want to use one of those per animal. And that does not mean one side per animal. That means one towel per animal. If we're using something like a microfiber towel, when we launder them, we want to wash them in cold or hot water, but with bleach and with detergent. We want to make sure we have bleach and detergent there to kill anything on those towels so we don't reinfect anybody after the next milking. And we want to dry those on high heat. If we're using individual use paper towels, we just throw those away and then keep on trucking after that. When we attach that milking unit, again, try to pay really special attention that we're not over milking those udders, and then putting on a post-dip afterwards and keeping an eye on them. But really, the biggest thing to try to get your production ramp back up is going to be going through a dry period, letting that udder completely re-involute. It takes a good 40 days to go through udder involution. So we need to give her a little bit of time to just kind of rest and relax and go through that process and then get her milking again. Everybody got that question right so far. Yay. Yeah. Anybody else going to answer? We only got 7 people to do it this time. So
Yeah, I left it open, but maybe people
close.
are exiting as we're talking here. But I'll
That's okay.
probably end the poll here.
That's good. And then we can
We'll
share
keep
those
this.
results.
Yeah. You want to share those results now?
Sure.
Is that what
Yep.
you? Okay, let me go back. Let's see. Okay,
Good job, everyone.
so
You all
yep.
got allied. Perfect. We were all over the board at the beginning and we all got there at the end. Milking procedures to maximize udder health. All of the above. Absolutely that one. We want to do all of these things, but gloves are extremely important. So if we got nothing else from today but wear gloves, I'm happy with that. Gloves are extremely important. And then the mastitis pathogen, more likely if offspring are nursing, it is going to be this Pasteurella hemolytica. This is the one that we're going to get from those nursing offspring back to mom. So good job, everybody. All paid attention. I'm so proud of you.
All right. Well, I don't see any more questions in the chat. It looks
Oh,
like
okay. What's your question?
um,
You have one.
yeah. And if it's easier for you to type or if you need to unmute, I think you could do that as well.
Is resistance to mastitis heritable? That is a great question. We are seeing that we can track resistance to mastitis through genetics in cattle. I don't know that anyone has looked that closely at it in sheep and goats, but I would suspect we probably have some heritability there. It is not highly heritable, though. So it's not like if mom didn't ever get mastitis, daughter is guaranteed to not get mastitis. Less likely, maybe, but it's not a one for one shot, if that makes sense. Good question, though. Any more questions?
I don't see any more in there. One thing I would note is I did put the link to the evaluation in the chat. If people, before they log off here, wouldn't mind clicking on that, that just helps evaluate our webinar series and get some input from you on what you'd like to see in upcoming topics. So would appreciate that. We'll also do a follow-up email with everybody that registered here today with all the attachment of the PDF and the evaluation link. And then once this is archived, we'll give you a YouTube link to go back and view it. So I don't have any other things unless you do, Liz, but I think
No.
we'll end it at that. We appreciate all the insight you provided.
Yeah, thanks for having me.
Thanks, everybody.